and welcome to this Care Talk Business podcast. My name's Karen Rogers, owner and director of the Herefordshire Care Homes Group. My guest today is Helen Hayes MP for Dulwich and West Norwood and co-chair of the APPG for Adult Social Care. Good morning. My guest today is Helen Hayes MP and co-chair of the All-Party Parliamentary Group on Adult Social Care. Welcome, Helen Hayes. So I've just got a few questions I'd like to ask you for this business Care Talk Business podcast. You've been fighting for reform of social care system. Where does your passion and drive for this come from?
Thank you very much, Karen. Can I just say, first of all, how pleased I am to be joining you today, and thank you very much for having me. And also, just what an extraordinarily difficult year this past year has been for everybody working in social care. We know that the social care sector is full of incredible people working extremely hard all the time, and all of you have just been through so much. So I'm just want to acknowledge that at the start of this podcast. In terms of my passion for social care, so I'm acutely aware as a member of Parliament, I represent a constituency in South London, of the impact that social care has on so many thousands of families up and down the country, whether that's families who have a loved one living in a care home or people in our communities managing their own care at home, and obviously unpaid carers as well who do such a huge amount. And sometimes as an MP, there are issues that come to you that you feel a very strong sense of responsibility to work on, and social care is one of those issues that as an MP what you see is people, individuals battling with the system, and by the time people get to that situation where they or a loved one needs help and support and they're battling with our system to access that support, they can't be advocates for social care, they can't be campaigners for social care, that they're focused on their own situation. And I think that's one of the reasons why social care is sort of under debated and under talked about in our politics very often. So that's one of the reasons why I feel passionately about it. I think the other thing is that, like so many families across the country, we have had in my family experience directly of our social care system and some of its limitations and failings. My grandfather, who sadly passed away a few years ago now, had a long stay in hospital, and as a consequence of which he couldn't then live independently anymore, and we faced exactly that battle that so many families face to get the care package in place, to identify a home that was fit for purpose for his needs, and all of the things that go along with it. So this is personal as well as political, but I really just find myself in a situation wanting to do what I can to drive the change that's so desperately needed in social care.
Thank you, Helen. Yes, I mean, it is so difficult for families because they come to social care usually at point of crisis. So yeah, I think we all acknowledge that. A couple of years ago, 2018, the Association of Directors of Adult Social Care warned the government that we were ill prepared for a pandemic. But sadly, no action was taken. Do you think any lessons have been learned from their failure to act?
Well, so that public warning from ADAS came 2 years after the government itself had undertaken its own internal exercise called Operation Cygnus on its preparedness for a pandemic response, which we know highlighted specifically vulnerabilities for the social care sector. So actually, it's even more shocking that no action was taken when the government had done their own exercise, and then they were warned by professionals running social care that there were going to be problems in the event of a pandemic. And we have seen the toll that failure to act has had on the social care sector, and we have seen, very sadly, people die unnecessarily in large numbers because that there was a failure to act in the face of warnings that were very, very explicit. So I think at this point, it is absolutely vital that lessons are learnt for the future. That's one of the reasons why my party, is that the Labour Party, are pushing for a public inquiry to start this summer while the experience is still very, very fresh in everybody's minds, and so that lessons can be learnt as quickly as possible. But I have to say, I feel when I talk to people across the sector, there has been a huge loss of trust in the government because of that failure to act over so many years. So we need to come through this crisis learning the lessons as quickly as possible, but also putting in place the reform and the resources to mean that lessons can meaningfully be learned and action taken, so that the social care sector never again finds itself in the situation that it faced over the past year.
Thank you. And throughout the pandemic, there have been claims of government support, but this varies greatly from what people on the front line have experienced. So what could have been done differently, and how would you have supported those frontline staff?
So one of the things, as the co-chair of the All-Party Parliamentary Group for Adult Social Care, we have a working group for the APPG, which is drawn very widely from across the adult social care sector. So we have some quite large care home providers. We have people who manage their own care, people who've lived experience of social care, people who provide care in people's homes, and a whole wide range of bodies. From the beginning of the pandemic, we were meeting every single week as a working group, and that provided me with absolutely invaluable insights into what was happening on the ground. So I was able to compare that, what members of the working group were saying, against what the government was claiming, and there was very often throughout that period a really significant mismatch. So particularly around access to testing, which we know is a sort of vital tool for protection and for prevention of infection spread, and also PPE supplies that the government was saying it's all fine, it's all been put in place. People working on the ground were saying, no, it's not fine, and this is our experience. We've got a fraction of what we need. We're going to run out of PPE. We haven't had testing. We can't get access to testing, again and again and again, week after week after week. And I think it was very clear that social care was not at the top of the agenda, and the NHS quite rightly was at the top of the agenda, protecting the NHS from being overwhelmed by the pandemic. Nobody would argue that shouldn't have been the case. Of course it should have been the case, but alongside that we should have seen a focus on protecting those people who it was known would be the most vulnerable to this new disease, and they were frail elderly people, very, very often living in care settings, and that infrastructure of support, access to PPE, access to testing, proper protocols for testing on discharge from hospitals, all of those things were very, very clearly needed. And the great frustration at that time was that they weren't being provided. Care homes, care providers were calling for that action, and it took far, far, far too long to come from the government.
And on the specific suggestion that people would be tested before being discharged from hospital into care homes, are you able to make a comment on that, what that response was?
Well, we just know that it wasn't happening. We know that hospitals were under enormous pressure to free up beds, again, for completely understandable reasons. Care homes were under enormous pressure to take patients on discharge from hospitals, and the infrastructure around testing, just the system for testing, something that should have been absolutely routinely, systematically undertaken, was not in place, and it was not in place for a long time after the start of the pandemic. And it's one of the things that needs to be a focus for the inquiry. And I called in Parliament just a couple of weeks ago for the public inquiry to have a separate strand just for adult social care, just for looking at what was happening in the care sector, so that all of those issues, the evidence from the sector, can be properly gathered and analysed and understood, so that the lessons can be learnt for the future.
Thank you. In some parts of the country, social care workers are one of the highest groups for vaccine hesitancy. Why do you think this is? And have you done anything that could change this?
So it's been very, very striking looking at the data since the start of the vaccine rollout, that care workers as a specific group in the population have had very low rates of vaccine take up in large areas of the country. I think the reasons for that are really complicated. I'm not sure we kind of fully understand all of the reasons, but I think there is definitely something about a sector that felt left behind throughout the pandemic, and where there has been a sort of breach of trust, and lots of workers not feeling that they've been well supported by the government, then perhaps feeling reticent in relation to messaging from the government. So I think that kind of trust issue is very important. We know that vaccine take-up has been lower amongst some Black and Asian and minority ethnic communities, and that the care workforce is a very diverse workforce, and we also know that kind of logistics make a difference, and support at work makes a difference. So vaccines need to be readily available in convenient locations for people, and you need to know that if you're going to feel a bit rough the day after your vaccine, that you can take time off work, that you'll be paid for that. You need to know that you'll be paid to attend your vaccine appointment. So there are lots of issues, I think, some of which are about practical barriers, some of which are about building trust. In my own area, it's been on my radar since the very, very start of the vaccine rollout. We have seen very significant health inequalities in the first wave of the pandemic. The absolute last thing that we need to have with the vaccine rollout is those health inequalities being further compounded because of low vaccine take-up. And we also need to make sure that people living in care settings and receiving care are protected, because that those who are supporting them are vaccinated as well. So it's a really important issue. In my area, there's been all sorts of innovative practice that I know about, of a lot of it about providing opportunities for people to have their questions answered and their concerns taken seriously, and just the opportunity to talk through what you're worried about, and to have a conversation about the evidence and what you might have read on the internet, and all of those things. Making vaccines really available in convenient locations. So we've had lots of pop-up clinics in faith communities, on some of our housing estates. There's been a bus that's been going around part of my constituency. All of that is important. And then I think part of it as well is just, for lots of people, it's about that there's been a tendency to wait and see, and just kind of, if you're a bit worried about it, just to kind of wait and see and watch your colleagues and your friends and family get vaccinated, and get a bit of reassurance from the fact that that's all gone fine for them. So we are seeing take up increase steadily over time, but we definitely need to kind of keep the attention on that equalities issue, and make sure that take up is as high as it can be, and that there aren't communities that have been left behind by the vaccine.
It's fantastic, and it's good to see the numbers are now starting to go up on this.
Yeah.
You're passionate about issues affecting people with learning disabilities and/or autism. Can you tell us a bit more about the work you're doing to encourage more community-based services? And also, how would you tackle the health inequalities that people living with a learning disability experience?
Yeah, so this again is an issue that it's so important, and it came to me, like many things do, through a specific case in my constituency. So I hadn't been very long elected to Parliament when an incredible woman called Isabel Garnett came to my surgery to talk about her son Matthew. And so I got to know Matthew's story. Matthew was at that time 15. He was had been sectioned because of an incident with his behaviour, and his family had found themselves in this kind of Kafkaesque nightmare where Matthew was then stuck in a secure hospital environment, and they were watching his health really deteriorate because his needs weren't being met, and they couldn't get him out. And as a consequence of that case, and I went to see Matthew in the hospital, I kind of saw how bad things were for him. I saw how the team was working not very well around him. And in the end, we got Matthew into a much, much, much better setting where he still is today, where he's absolutely thriving, living in a small village, with, living in the community, volunteering in the community, doing all of the things that he loves. And he couldn't be a more different person from the one that I saw in that hospital environment. And so that then you find out about the bigger issue. And the bigger issue is that 10 years on, as we are now, from the Panorama documentary that exposed the scandal in a hospital for people with learning disabilities and autistic people at Winterbourne View, 10 years on, there are still about 3,000 people with learning disabilities or autistic people living in hospital environments that on the whole don't meet their needs at all well. And the government made a commitment following Winterbourne View that they would take a completely different approach, that literally literally the Transforming Care programme was supposed to ensure that those residents were living in community settings that could meet their needs properly, rather than in hospital institutions that on the whole cannot. And they have failed to deliver on that commitment. And that, to my mind, is a shameful failure. And it speaks actually to the broader delay in delivering social care reform that we so urgently need to see, because this is a part of that. This is a part of what is our vision for social care, what is our vision for the way that people who have support needs, whether it's because they are elderly and frail, or because they've got a learning disability, or because they're autistic, or because they've had a brain injury, or or because they have mental health needs. What is our vision for the way that people who have vulnerabilities and need support should be able to live in our communities? What's our vision for the kind of support that should be available to any one of our family members should we find ourselves in need of support? What is our vision for how that is funded? What is our vision for how we live as communities with very, very diverse needs? And so what I try to do in Parliament is to push the government on that reform, hold them to account for the failures of the last 10 years, and we'll have an opportunity hopefully to do that again later this week when we're debating again 10 years on from Transforming Care. What is the situation and what needs to happen to make it right for people? But it genuinely is heartbreaking, the number of families who are battling with a loved one in accommodation in a hospital that does not meet their needs, where often their rights are not respected in the way that they should be, and who just needs to be looked after in a way that they can live as independently and as full a life as possible. And we need to see change.
Thank you, Helen. You're also an avid campaigner for mental health equalities, and particularly services around the BAME communities. How can we support the workforce and people who use those services?
So I think with mental health services, there is a big opportunity just now through the review of the Mental Health Act, which the government has just consulted on reforming the Mental Health Act, and we believe will bring forward legislation in due course following that consultation. And that's very much where my focus is at the moment. And it is, as you rightly say, on trying to ensure that we have mental health services which are fit for the purpose for the needs of our diverse communities. And that for me, that I represent one of the most diverse communities in the country. I also represent an area that has very, very high incidence of mental health needs, and I see that the interaction between just some of the kind of history in our communities, some of the battles that people have had to fight in the past, some of the racism and injustice that people have had to endure on their mental health, and then also on trust in the systems that are supposed to be there to support people, whether that's policing, whether that's mental health services, whether that's our government more widely. So we need to have mental health services that are genuinely informed by listening to the lived experience of all of our diverse communities, and we need to have an approach to reform that is based on rebuilding trust and confidence, so that people can access services when they need them. But we also need to have an approach to mental health that is about parity of esteem for physical and mental health, that enables all of us to talk about our mental health in much the same way as we talk about our physical health, enables all of us to seek help and support much more readily, much earlier in a deterioration of mental health, so that our focus is on prevention as well as about delivering services for people who become very seriously unwell. And we have a situation where mental health services have been historically underfunded and not prioritised sufficiently. So getting that genuine parity of esteem is also really important.
And talking about underfunding, why do you think social care is so underfunded and undervalued?
Well, we've just, we have known about the need for reform of social care for a very, very long time now, and social care is underfunded because we don't have a funding mechanism for social care that is fit for purpose. And this has been a significant failure of government to deliver the reform of social care that we need. As somebody who co-chairs an all-party parliamentary group, one of my frustrations is that there has been a huge amount of cross-party work on social care going back over many years. We've had cross-party select committee reports which have really looked in detail at kind of what are the options for funding social care that the government could consider. We've had lots of work by all-party parliamentary groups, lots of work in the House of Lords and in the Commons by parliamentarians from all political parties to kind of try to work out what the solutions might be. And social care always ends up being the political football, and so that kind of cross-party work breaks down at elections. And we need to get beyond that, and we need to kind of it is for the government to show the leadership on this issue and to open cross-party talks in good faith, with a kind of depth of commitment to get to something that can command agreement across the political divides. But the options for social care reform are well understood. The good practice from overseas is really well understood. The extent of the kind of funding gap and where we need to get to is absolutely quantified. So it is at this point, it's a question of political will to deliver the reform that's needed based on the options that are available.
Great, thank you. And apart from concerns around pay within social care, is there anything else you think can be done to increase recruitment, improve recruitment and retention of staff within the sector?
Yeah, so I think pay is important, and I've said many times, I don't think there isn't a route to social care reform that doesn't involve addressing the issue of pay. Social care work is hard and it's skilled, and I don't know why we should expect people to do that kind of difficult, skilled work that demands emotional and physical commitment, and everything that we know that social care workers put into their roles, for the same amount that you can get paid working for the local supermarket, where you also get a discount on your weekly shop. I mean, it's that's a terrible scandal, really, that we expect people to turn up to work in social care for that level of pay. So pay is really important, but I think it's also important that we address the issue of career progression within social care. People should feel like social care is a career choice where they can start and they can get on and they can do well and really kind of go from strength to strength and build a career in social care. We need to address terms and conditions as well as pay. So pay is one part of it, but if you're still working on kind of very fragmented hours throughout the week, if you're still not being paid for the time that you're spending kind of traveling between appointments, those kinds of issues, then pay is only part of the solution. We need to address terms and conditions as well, and we need to just give social care the recognition that it has alongside health. More people work in social care than work in our NHS. It's a huge, that social care workers are a hugely important part of our economy, as well as an important part of the social care sector, and we need to make sure that they have that value, that recognition as the kind of absolutely essential frontline workers that they are. But I think pay is important, terms and conditions are important, the value and the esteem that we give to the profession, having a system. We talk about the social care system, but the reality of social care is it's incredibly fragmented. So all of those things are important for recruitment and retention of care workers into the future.
And we see this as care providers and employers all the time, and it's humbling, to see the level of skill, the amount of commitment, and what's expected from frontline social care workers. So that reform is absolutely desperately needed, and I guess it is going to come down to what does care cost, the cost of care, social care reform generally. So given all of that, then what do you think the future holds for social care? What's our social care future potentially going to look like?
Well, we as parliamentarians, I'd say there's an enormous amount of frustration, particularly on the opposition benches, at the government's continued dragging its feet on social care reform. We have had years of discussion about the need for reform. As I said, the options for reform are kind of well understood and well known. And then added to that, we have had this year of terrible strain for the social care sector, which has given new visibility, I think, for the first time, really. Social care has been known and talked about amongst people who don't have a direct connection to social care through a kind of loved one who has social care needs. So the urgency of the issue couldn't be more stark, and yet we still had a Queen's speech which only gave 9 words to social care and only promised that the government would bring forward proposals. It didn't promise specific legislation or a specific timescale or a new bill in the Queen's speech. So our immediate job is to keep on pushing for that reform to be delivered as quickly as possible. But as I said in a debate just a couple of weeks ago in Parliament, the process also matters. So it won't be okay for the government just to publish proposals and expect that everybody will vote for them. That they need to be proposals that are informed by genuine cross-party talks and engagement, so that government can be confident that they have the support of parties across the political divides in Parliament, and they need to be proposals that are brought forward on the basis of engagement with the social care sector and people who rely on and live with social care support every single day as well. And so that's what I want to see. I want to see a firm commitment from the government to engage and discuss and have those cross-party discussions and those discussions with the sector, but to bring forward concrete proposals for social care reform very, very quickly, because social care has waited far too long for those reforms.
Thank you, Helen. That was also encouraging to hear all of that.